A febrile seizure is a series of spasms and convulsions that occur in a child due to a spike in body temperature. According to the CDC, fevers can be caused by common childhood illnesses like colds, the flu, an ear infection, or rosola. Vaccines can also sometimes cause fevers, but febrile seizures are uncommon after vaccination. There is, however, an increased risk for febrile seizures after MMR and MMRV vaccines. Almost 5% of young infants and children will experience febrile seizures. Infants and young children are most at risk for febrile seizures, and they can occur in children between the ages of 6 months to 5 years old, but are most common between 14 and 18 months of age. The CDC says that studies have shown a small increased risk for febrile seizures during the 5 to 12 days after a child receives the first vaccination with the measles, the mumps, the rubella, or the varicella or MMRV combination vaccine, but the risk is still small. Studies have not shown an increased risk for febrile seizures after the separate varicella vaccine. There is a small increased risk, however, for febrile seizures when inactivated influenza vaccines or the flu shot is given at the same doctor visit as either the PCV13 vaccine or the Tdap vaccine, or when the PCV13 vaccine is given by itself. Believe it or not, vaccinating your child at the recommended age can actually prevent febrile seizures by protecting children against harmful illnesses like measles, mumps, rubella, chickenpox, influenza, pneumococcal infections, and other diseases that can cause a fever. Yes, the CDC and FDA work closely together to ensure that vaccines provided to the public are safe and effective. The CDC and FDA also continue monitoring vaccines even after they have been approved to make sure no vaccine becomes harmful.